The misuse of prescription drugs has become a growing problem within the United States and worldwide. During the span from 1995 to 2002, the amount of narcotic analgesics in one system increased by 153%, with oxycodone being the leading drug. Among the younger generations, this problem is more severe and constantly increasing. During a 2003 study, 10.5% of 12th graders and 7.5% of college students use Vicodin, a common analgesic, for non-medical purposes in the past year.
According to Brown University, the four most common misused drugs are the opioid class, followed by tranquilizers, stimulants, and sedatives. Oxycontin, Vicodin, and the generic oxycodone and hydrocodone fall under the opioid class. Oxycodone is the most misused prescription drug. Many who are addicted to the drug explain that it gives them a sense of euphoria. To quicken the effect of some of these pills, many may crush the tablets and snort the powder. Because oxycodone is water-soluble, some will chew the tablets. Chewing the tablets allows them to dissolve in your saliva and get into your bloodstream faster. Oxycontin and heroin have similar effects. A 100-tablet bottle of Oxycontin could cost $400 in a pharmacy. You could sell that same bottle on the streets between $2,000 to $4,000 illegally. Because of the lower cost, many heroin users are switching to Oxycontin, increasing the abuse of prescribed medication. Shown here is the chemical makeup of oxycodone. The National Survey on Drug Use and Health Data showed that 8.2% of adolescents ages 12 through 17 misused at least one prescription medication. In the past year, of the group of youths who misused at least one medication, 36% exhibited one or more of the symptoms of a substance use disorder in the Diagnostic and Statistical Manual of Mental Health Disorders. A total of 17.4% of those who had misused a medication met criteria for either substance abuse or substance dependence.
The common motive that initiates drug seeking is that of pain management. Evaluating pain is very difficult for healthcare professionals, and the extent to which patients are hurting is very subjective. It can be disguised by emotional behaviors. Other motives that encourage people to seek prescription drugs are to have something to rely on to help cope with other problems they encounter in life, such as problems within a family, financial problems, or other common stressors. And when money is tight, people resort to selling certain drugs to compensate for a decline in household income.
Predictors for prescription drug abuse was found to be 15 years of age or older, poor academics in school, a past year depressive stage, mental health treatment, or use of other substances. The strongest predictor was using those prescription meds 10 or more times in the past year.
4 misunderstood reasons for drug seeking are addiction, pseudo-addiction, tolerance, and physical dependence. An addiction is said to be a behavioral syndrome characterized by psychological dependence and abnormal drug-related behaviors. Pseudo-addiction is usually the result of undertreated pain, attempts to obtain more medications as a result of unrelieved pain, or fear of running out of analgesics. This type of behavior is commonly observed in patients with continuous severe pain or when drugs are administered inadequately. Tolerance is a learned cellular response requiring higher doses of analgesics to achieve the level of pain relief previously fulfilled by a smaller dose. This does not always signal an addiction. Physical dependence is a normal physiological response to continuous opioid therapy, with the appearance of withdrawal syndrome when the drug is abruptly discontinued. Physical dependence alone is no relation to addiction. Although it is pertinent for healthcare professionals to trust their patients and accept their testimonies as the truth, a slight bit of skepticism is always in the back of their minds, not because they are prejudiced, but they are aware that drug seekers can come in many different forms, and they must feel each patient out. 3 common characteristics of drug seekers. 3 common characteristics of drug seekers are escalated use in prescription drugs, provider shopping, and scamming. Escalated use is detected when the patient is consistently running out of medicine before their follow-up appointment, or sometimes they claim to have lost their medicine. Provider shopping may be detected by local pharmacies at first. While trying to obtain certain drugs, provider shoppers are frequently at emergency rooms and may have several medication providers. A lot of times they claim they have no primary physician. These people often seek treatment after hours or when clinics are busy in hopes of being run through and getting a pain script instead of an adequate evaluation. Scamming is basically when patients lay on the compliments thick. They may compliment the office facilities, the provider's appearance, or even the provider's reputation within the community. If the patient feels that their compliments are not going anywhere, they may push the provider into giving them a prescription by threatening them to go somewhere else, or even filing a lawsuit for failure to treat them. Scammers may very well be exquisite at reciting textbook symptoms and medications for treatment. They may request a certain drug, claiming many excuses for the refusal of others, such as they are allergic to them or they don't work for them.
Physicians are time pressured as it is, and integrating young adults about abuse of prescription medication is hard to do. However, screenings do help. The downfall is that kids can lie. Including questions about prescription drug misuse will help figure out more on the issue. Illegal internet pharmacies are a big problem in distributing these medications. Although authorities are trying to shut down these websites, it is almost impossible to shut down all of them. To help in the prevention of adolescent drug abuse, parents need to keep an eye on their children's internet access and what they are looking at. It would also be a good idea to keep count of what is in your medicine cabinet and hide prescription medication. That way, your children or their friends cannot get their hands on it. Also, parents are encouraged to talk to their children about the issue.
Each time a provider prescribes a certain drug, they should present to the patient the diagnosis of the person's illness, information on the drug itself, including side effects, signs of allergic reaction, dosage timings, administrative instruction, and potentially addictive properties. Also, the provider needs to inform the patient of follow-up parameters. I'm here today with Dr. John Page, a dentist in Tompkinsville. Do you see patients that present for just pain medicine?
Yes, quite frequently actually.
What are the commonalities among drug-seeking patients?
Well, these patients a lot of times will come in, complain of pain. Their usual age is somewhere maybe between 18 to middle 40s. They can be outside of that. They come in with a specific area, and you see a lot of common traits between these patients when they present. A lot of times their description doesn't add up to what you see compared to the normal, and they usually exaggerate their responses to our tests as such.
Why do patients seek prescription drugs?
Well, we've always been taught that the prescription drug they seek fills some kind of need or void in their life. Either sometimes they can take this drug and are addicted to the effects of it, or they can even take it for such thing as insomnia. Also, a patient can come in, maybe possibly get a tooth pulled, and know they have a legitimate reason for pain medicine, maybe get 15, 20 lower sets or hydrocodone rote, and they can take a few for themselves and sell the rest and come out money ahead.
Do you feel like the drug-seeking patients are a burden on the healthcare system?
Yes, they take up a lot of time. You can't just, once you know the patient and know they have a problem with it, you can kind of sometimes adjust the schedule knowing that that's the case. But on new patients, you never know if they're being legitimate or if they're just trying to get a script.
When these patients come in, do they want certain drugs over others?
Yes, there is definitely they get upset if you write them something that's in a capsule versus a tablet. They like certain tablets that have markings on them that gives them more street value. If the patient itself themselves are seeking the medicine for themselves, they don't care because they know they're getting hydrocodone, or if it's in a capsule or a tablet. But if they are trying to sell them, a lot of times they want the what they call the horseshoe on the pill.